and sometimes they may need a better social support. Unfortunately, often there may be people in a job that doesn't match, or somebody who's really hard to live with for different reasons. And sometimes you have to say you need to take a break from work or get a new job because that work environment is not going to change. But often people are in a tough spot, earning a living, supporting their family, and often don't have great options in that. And that can make it even harder. One of the thoughts too, and is that meltdown, temper tantrum difference, and was talking about somebody who was seeing the parent, and I don't see the child, but was talking about the 5 or 6 year old who was having these temper tantrums, and pediatrician said, "Oh, they're normal," and because mom was having headaches, stress headaches, trying to help support a family, a young family. And she had said, then we went to a developmental specialist, said, "Oh, those are just normal." And she said, this is a business person, not a health expert therapist, and said, "I don't think they're normal." And I just said, "I'm just curious, does she have any sensory differences like tags or smells?" And she's, "Oh, she can't stand tags. Her dad can't stand tags. Grandma can't stand tags either, come to think about it." I said, "Oh, what does dad do?" "Oh, he's an engineer. He's a fun engineer, not like the normal engineer you think of." You start to go, "Oh, okay." Reframing, but getting to the thought of how this has to upset the apple cart, because reframing, re-diagnosing, re-understanding, and actually reparenting somebody who's autistic, and more often masking type autistic, is, oh, you're just feeding into that by letting them have that. And so that's one aspect of reframing that. And then the other aspect that I want to ask about is, some autistic adults may feel sad that their parents never diagnosed them or figured it out.
Yeah.
I guess first to that first part, and then also to that second part.
Yeah. So definitely understanding your child's neurotype, whether it's autism or ADHD or whatever, it does change the way you parent them. And a core parenting dilemma for any parent of any child is, to what extent do I need to accommodate and support versus draw a hard line and say, suck it up, kiddo. Like, you can do this, like, you can be strong, right? And where to draw that line. And that's hard. And it's an art. There's no science to it. And that's even harder when you're raising a neurodivergent kid, to try to understand, to what extent should I be accommodating, and to what extent do I need to hold them to a high standard and support them and say, you can do this, right? And there's no easy answer there. But knowing your child's neurotype completely changes the way you parent them and helps you become a much better parent. And in a thousand little ways. Here, I'll tell a story that I don't look very good in this story, but I'll share it anyway. My side of the dinner table in my family is me and my daughter who has ADHD. And then across the table, we have my two adult autistic kids. They're young adults. My husband sits at the head of the table, so he's not part of this story. So we have the ADHD side of the table and the autism side of the table. We're very open about neurotype talk in our family. And one night, my ADHD daughter was telling a story, and my autistic kids were not making any eye contact at all. They weren't even remotely looking in her direction as she told the story. And as a non-autistic person, I got like irritated by that. I felt it was disrespectful. And so at one point I said, "Hey, autistic people, how about some eye contact for the non-autistic people?" Because that's how we talk in my family. I know that's not for everyone, but it works for us. And they laughed because it was funny. And then they rightfully put me in my place and said, "Why should we have to make eye contact here in the house? Like, we have to do it out there in the world, and we do. But this is our home too. Why do you get to set the rules about what eye contact is correct and what is okay?" And they were right, of course, which doesn't mean that I was wrong, because I have my own neurotype and I'm allowed to have my own needs and preferences. The point is not that the non-autistic person is wrong either. It's just, it opens it up to have these conversations, to learn about each other and to go, "Oh, that's how you experience it." And so I learned I don't really need eye contact from them, but I do need some sense that they're listening. That feels important to me, which they can do in any way they want. Say, uh-huh, once in a while or something.
And I think of a common kitchen table thing that many people listening have heard is, you're chewing with your mouth open. You're chewing too loud. And the person, no, I'm not. And it's going back and
Yeah.
forth. And you're like, oh, wait a minute. Somebody has a different sensory system.
Yeah.
And to them, it does seem that way, but it doesn't
Right.
to me. And the person who doesn't know that they're, and often this can be misunderstood on the autistic person, you're so sensitive. And they
Right.
get blamed and they're like, no, I'm not. And then there's this back and forth misunderstanding that you're not pronouncing language and social awareness differently. And I have a patient I've seen for years, and she said, boy, Dr. Lenz, you sure have changed in the last 8 years because of your understanding, because I have this growing understanding of neurodivergency. And she had been told for years by an ex-spouse that you're so sensitive. You're so sensitive. And then she said, sister said she's autistic and she's got an autistic daughter. And I found out. And so, okay, reframing this, maybe a marriage would have been saved if somebody would have understood, oh, I guess I am more sensitive. But the way it's framed is you're disordered, get
Yeah.
your stuff together. And the other person doesn't understand. No, she just has the alert system is at that high level, and just validate and talk about it. And any thoughts on that?
And I'll tell you what, what we're talking about here is the crux of a new book that I'm working on with Megan Anna Neff. So funny that you just interviewed her. Didn't know that when we started, but yeah, we've been working on a book about cross neurotype communication. With this, our lens, of course, is that nobody's right, nobody's wrong, but people are misunderstanding. And if we understand each other's neurotypes, then these little things, like this example you're bringing up, is such a great example with the chewing. And that's actually a very specific type of sensory hyperresponsivity called misophonia. And people who have misophonia, they don't just find chewing to be annoying. Like it can create almost like a rage reaction for them. It's a physiological response. And that can cause such huge conflict. I know families where they literally can never, ever eat a meal together because one person has misophonia. And if you don't understand it from a neurotype point of view, yeah, it can wreck relationships. But once you understand it from a neurotype point of view, oh my God, it opens it up to have healthier relationships and productive communication. And people aren't blaming each other and people aren't blaming themselves as much anymore. So it really goes back to this. I'm such a believer that it's not about diagnosis, but it's about understanding yourself and having words to understand your own neurotype and everybody else's neurotype.
Yeah, I think that is a great book to add to this. And that's for me, having that awareness too, that, oh, this understanding and knowing this. And then actually, a lot of times that's validating for those who are listening. And it's not a battle of who's right. And it also can cause stress within relationships for being misunderstood and what action somebody takes. Also, many people are neurodivergent, marry another neurodivergent person. So you may have somebody with rejection sensitive dysphoria who then gets rejected because the person can't deal with the snoring a little bit and doesn't think it's that bad because their friends said it wasn't that bad when I was with them. They weren't, now you're in the other room, but that can create, I love you, but I can't handle the snoring. It's causing me to not sleep
Right.
well. And it's grinding. One thought, and I guess speaking to maybe an adult out there who may be really frustrated because they may have just self-diagnosed that they're autistic because there's a lot of information out there, maybe not formally diagnosed or not, and then may look back at their parents and say, why didn't you understand? Can you speak
Yeah.
to both sides there? Thinking of somebody maybe in their 20s who now where we're at, and
I want to validate everybody's feelings because of course in these situations, and hey, I do a lot of late diagnoses, people in their 20s through their, 70s, or actually at our practice, we had one person in her 80s who came in saying, I just want to know if I'm autistic. I just want to understand myself. And of course, when you say, yeah, you're autistic, there's all kinds of emotions on the parent side and the individual side. And that can include positive emotions. There's often so much relief and so much validation, and like things have come into focus. And there's a lot of negative emotions. So on the kid side, yeah, there can be anger towards the parents and towards prior evaluators prior clinicians who missed it. And on the one hand, that anger is entirely understandable and valid, and I want to validate it. It's also true that we as a field just didn't know that much about this 10 years ago, even. Certainly 20 years ago, 30 years ago, 40 years ago, forget it. And the research shows the older you are, the less likely it is that your autism would have been recognized, of course, with people born before 1999 being far less likely to have been recognized than people born after 1999. And yeah, I just try to talk with kids or adults who are getting that diagnosis who have that feeling and say, yeah, of course you're going to feel that way. And I don't think it's directed at any one parent or clinician. It's we as a field and as people, we just didn't know. We didn't have that knowledge. So it's not you. It's not like your parents made this mistake and everybody else's parents were getting it right. Nobody's getting it right. And then as far as the parents, I just talk about the inevitable guilt and just try to absolve them of their guilt and remind them that they did the best they could. And if the clinicians didn't know, how could they possibly have known? And that just because you feel guilty doesn't mean you are guilty, right? We get that guilty feeling and we follow it with thoughts and we assume we must be guilty because we feel guilty. But sometimes that guilty feeling is completely irrational, right? I have 2 children who are late diagnosed autistics. I could look back and get mad at myself for not pushing for the diagnoses earlier or recognizing it earlier, but I know I did the best I could. That's okay. That's all we can do. Yeah. So if you're somebody who's getting a late diagnosis or just late identified, or your child is late identified, when you have all these different emotions, acknowledge the emotions, know that's a normal part of this experience. Try to be compassionate to yourself and everyone else and know that's just where we're at.
Yeah, and hopefully we can gradually change this over time. Wanted to just get a chance for you to share about, maybe bridge both. If you, in your own words, can talk about the value of both of your books, and also with this course that you have coming out.
Which I don't know which course you
Oh, I thought I saw something online that was,
have a few.
well, I think it was about autism.
I think,
I think
yeah,
it
I
was
think,
based on the book. It was like a
yeah, I
module
think
or
you mean
like
a
a
webinar, maybe.
webinar.
Yeah.
Oh, okay, maybe a
Okay.
webinar.
Yeah.
Maybe I thought it
Okay.
was a course.
I think it is called a course on the website. I think.
Oh, okay. That's where so I
I'll
guess
look
talk
it up.
about, I guess, so for those, what can they expect with reading your book, at least the first book,
Yeah.
and the second book? I guess maybe give a synopsis for those out there, because I think it's really good, but then give you, as one of the main authors here of the book, to talk about what value and what they would get out of that often they wouldn't know. And I guess maybe to summarize it, and we've been talking about this, but I want you to get a chance to share.
Thank you. So the first book, so they look very similar, but one is green and one is blue. They have the same title, but a different subtitle. So the first book is the green one, Is This Autism? A Guide for Clinicians and Everyone Else. And that one, the crux of it is walking the reader through the 7 core diagnostic criteria for autism and what it really, all the different manifestations, particularly in autistic people who camouflage. So all the different things to look for. And it is great. And we also talk about, we have a chapter on co-occurring conditions, because autism never ever travels alone. And importantly, autistic strength, because it always comes with strengths. So it's good for clinicians. Like I literally get emails every day saying something to the effect of, I wish every clinician had a copy of this book. And I wish that too, not because I would get paid for it, but because we don't have good training about what the criteria look like and how they can manifest in autistics who camouflage. And every time I go and do trainings, and I've done trainings at major medical schools, major universities, lots of psychologists and psychiatrists who then email me the next day saying, thank you, this is the first time I actually understood what I was supposed to be looking for autism. And so for clinicians, for sure, but then adults who think they may be autistic and really want to think through it in an organized way, and potentially to prepare for their own evaluation. And for parents who are trying to figure out their kids and thinking, I don't know if my kid's autistic or not, but want to try to think through it again in an organized way and have words to put onto their experience or their child's experience. So that book truly is for everyone. The second book is more for clinicians, although my co-author Sarah disagrees every time I say that. She says, nope, it's for everyone. There's so much in there, recommendations. But we wrote it more for clinicians to teach them how to look for autism in their clients and how to make this decision with their clients in a collaborative way, and then what to do after you make this decision. So I think that blue book is of less interest to most people personally, but it's the green book that has interest. And one of the things we're really proud of is we did just a really comprehensive review of the literature. So it's very research based, but we also included quotes from well over 100 autistic adults. So you really get that lived experience woven in to the research and our clinical experience. And our goal was to make it very readable because, like many working parents, both Sarah and I are tired at the end of the day when we go to open a book, and we want it to be just very easy to read and easy to get through. And so we're really happy that people are finding it so easy to read. And then we have online videos. So if somebody learns better for orally and not by reading, we have on our website is thisautism.com. We have a few videos that go through the diagnostic criteria for autism. We have one for clinicians and another video for everyone else, although they're very similar. The one for everyone else is just a bit shorter. And we also have a video on our website about PDA, pathological demand avoidance, which is a really common thing that a lot of people wonder about when they're also wondering about autism. And we have a live webinar coming up in September. I don't know the date, but it's in September. And that one's really for therapists. And it is, I'll be presenting on how to know whether or not your clients are autistic. And then my colleague, Sandra Wolf, who is a really gifted therapist specializing in late diagnosed autistics, is going to talk about therapy in the context of autism and the trauma that inevitably comes along with being autistic in our culture.
Yeah. I like how you say in the book, and I like everything I learned from other people, but the pervasive desire or demand for autonomy instead of pathological demand avoidance. I like that, and understanding, again, reframing how somebody might have been told they were a narcissistic personality because everybody had to do it. Everything had to be done their way. And then you're like, no, that's how they learn to self-regulate when they have things that are routine, in control, done in a pattern. And then you can, again, reframe people who are often misunderstood. Are you taking new clients, and are you in a clinic that's, I imagine with this book, you're not hidden in the autistic world? And can you tell, because many people, I've had people say, contact me, I'm in North Carolina to do video visits. Unlike the psychology world, it's harder to get licensing, it's bigger work, and I just do video visits for people in Wisconsin here. But can you talk about, for those who really would like to see a compassionate, caring first person like yourself?
Thank you. Yes, I work at a private practice in Maryland. So it's right outside of Washington, D.C. And it's called the Stixrud Group, started by Bill Stixrud, who wrote The Self-Driven Child, my mentor. And so if people want to find out more, they can go to stixrud.com or to my website, which is drdonnahenderson.com for all that information, or isthisautism.com. It is the book website as well. And yeah, I see people for ages 7 through adults. I do tend to have a little bit of a waiting list, but I have colleagues who are amazing. Like really, truly, I would and have let my colleagues see my own family members. I don't refer to someone else unless I 100% believe in them. And I have some truly amazing colleagues who can see people as well, children through adults.
And do you do virtual visits?
I do, yes. Depending on what state. I'm side packed, yeah.
But part of that, I think 40 states really.
Yeah, it's called side packed, and yeah.
So most people,
not for full neuropsych evals, but for the autism piece. Yeah.
For that part. Awesome. So I always end with these kind of questions. One, can you share some thoughts or words of encouragement for those who are autistic and often living with some of these overlapping pain conditions, their loved ones, and then also for the physicians and clinicians out there.
Oh my goodness. Okay. Gosh, you ask good questions, and I'm a little bit of a slow processor. So give me just a second here. Words of hope and encouragement
So,
for autistic
so
people, for their
imagine
loved
some,
ones, and for clinicians.
imagine
Yes.
somebody's doing the laundry or in their car, and they aren't diagnosed as being autistic, but a lot of these may be ringing that they have wondered speaking to them, and also maybe
Okay.
having a lot of struggles because they're listening to a fibromyalgia podcast, so they may have some of these coexisting chronic pain syndromes.
Got it. Okay. So for autistic people, or people who think, maybe I might possibly be autistic, or my child might be autistic, I really want to encourage you to trust your instincts. Like, I can divide people into two groups who wonder if they're autistic or if their child is. In one group, it's just a very passing thought and it's immediately discarded. So I'll put myself in that category. Probably once a year, I have a moment of, wait a minute, maybe I'm autistic and I never realized it before, because I have things in common with autistic people. Like, I have some mild sensory sensitivities, but it passes pretty quickly because the more I think through the criteria, the more I think, no, the core of it just doesn't resonate with me. But for the people who hear about autism, and the more they listen, the more it resonates. The more they read about it, the deeper they feel it, either for themselves or their partner or their children. And if you're having that experience where it really deeply resonates and it's starting to feel like all the pieces are fitting together, pay attention to that. My clinical experience is, if you've really done your research and you really think you might be autistic or your child might be, there's an excellent chance that you are. So trust your instincts. And when you go to see clinicians, ask them, do you see a lot of autistic people who camouflage? And what are your thoughts about that? Because if the clinician says, I don't really believe in this camouflaging nonsense, then do not see that clinician. And then for all the clinicians out there, I really want to encourage you two things. One is to be brave to drop the A word, to say autism to your clients, to say, hey, I'm wondering if it's possible you're autistic or your child's autistic, to bring it up in the first place. Even if they say, no, I don't think so, you have planted a seed, you have brought it up. And to be brave to stand up to other clinicians, because even if you're seeing, let's say you're seeing a 40-year-old who's had a bunch of evaluations and seen a million clinicians throughout their life, and none of them has ever diagnosed autism, and maybe somebody even ruled out autism, that doesn't really mean anything at this point. And it's okay to say, I know you have this whole history and nobody ever diagnosed autism, but I still think you might be autistic. Even if Donna Henderson saw them 20 years ago, right? Because I can tell you, I was missing people right and left 20 years ago. So be brave, and separately, be curious. And this is something my co-author Sarah Wayland always says: let's meet difference with curiosity, not judgment. So when somebody moves through the world differently than you're expecting, or experiences things in a way that's different from the way you do, don't be judgmental, be curious. Try to understand it, try to learn, what's the story here, what's the person's experience, and see the whole person.
So well said. And any thoughts for their loved ones listening who may not have this neurotype? Any words that you can speak to them?
I think the same thing about curiosity is so important. And one thing is to read, besides my book, is books by and blogs and talks by late diagnosed autistics. There's so much of that out there, so many late diagnosed autistic people who do such a phenomenal job of explaining the experience, because the person in your life, the autistic person in your life, may or may not have that skill, either the self-awareness or the verbal skills to explain it, but there are people who have. So like, one of my favorites is called What I Mean When I Say I'm Autistic by Annie Kotowitz. Just a beautifully written book by a late diagnosed autistic woman who just really helps you understand what it may be like.
You enriched all of the listeners and myself in both the written book, and so thankful shared your wisdom to all the listeners.
Oh, thank you so much for having me. It's been fun.